Well, there's nobody's fault here. Nobody's made a mistake. But socialized medicine, and indeed in private practice, the general route for an infertile couple has usually been to go to a fertility unit. And the reaction of the fertility unit, not unreasonably, would be to advise IVF or one of the newer techniques, IVF using ICSI, IMSI, or PICSI. There are many acronyms. But the couple, therefore, are destined to have some kind of assisted reproductive technology. And it has been thought, previously not unreasonably, that because you couldn't do anything for a man, therefore there was little point in investigating him, and therefore the course was set and the couple were going to have a cycle of IVF. Of course, 30% of these couples across the board will be fortunate, but those who are not fortunate have missed the opportunity for investigation, particularly in terms of the men, and therefore they may have repeated cycles, once again without investigation. And therefore, quite simply put, these men have not been available to doctors, whether they be general practitioners or urologists, for further investigation and treatment. And this now has been the situation for nearly 30 years. So as a profession, as a group of urologists, these men quite literally have not been available for us to investigate and then explain, for example, unexplained infertility, and then to be able to work out ways of treating them. Yes, it is, because some forms, the minority of forms of male infertility, may also be associated with underperformance of the testicle in terms of its production of hormones, in particular the male hormone testosterone. And men who are deficient in testosterone in their 20s or early 30s may later suffer effects due to a low testosterone, including narrowing of the blood vessels, high blood pressure. They may also gain abnormal amounts of weight, and this is known as the metabolic syndrome. It includes, therefore, diabetes and many features when you put all these things together, which may result in shorter life expectancy because of the high blood pressure, because of the diabetes, because of the extra weight. And so we need to be mindful that some cases of male infertility can be associated with these hormonal disturbances, and that these hormonal disturbances may later, when a man is in his 50s, result in other quite serious conditions. Quite apart from this, of course, we find some men who inadvertently, without symptoms, have some infections. Not that these are serious, but nonetheless, there may be some consequences to their health in the longer term. There are a very small number of patients presenting, male patients presenting with infertility, who may actually have testicular tumours. We know that testicular tumours are related to undescended testes, and it's very important to identify these men early and to make sure that this small number are not affected by such tumours of the testicle.